Bismillahirrahmanirrahim. Hadith of the day. Prophet peace be upon him said, a believer does not taunt, curse, abuse, or talk indecently. Assalamu alaikum everyone. My name is Dr. Marina Akhtar, PGR Community Medicine. Today my topic of presentation is ergonomics and setting up of occupational health services. I am presenting this topic under the kind supervision of my professor Dr. Saira Afzal. Learning outlines. Introduction of the topic, dimensions of ergonomics, risk factors and solutions, basic occupational health services, recent updates and MCQs in the end. Learning outcomes. At the end of this presentation, participants will be able to describe the ergonomics, their dimensions, risk factors, solutions, and recent updates. Ergonomics. The scientific discipline concerned with understanding of the interactions among humans and other elements of a system, and the profession that applies theories, principles, methods, and data to design in order to optimize human well-being and overall system performance. Ergonomics means fitting the job to the workers, including workstations, tools, and equipments. Dimension of ergonomics. Physical ergonomics, it's mainly physiological interaction of the people and their activities that are concerned. Improvements are sought in the field of posture, body manipulations, carrying heavy weights, movements, especially repetitive ones, and the configuration of the workstation, safety procedures, and health in general. Cognitive ergonomics. Cognitive ergonomics deals with the mental, intellectual, and psychological aspects of the operator activity relationship. Their perception, reasoning, memory, stimuli, and psychomotor responses, etc. The improvement related with cognitive ergonomics have to do with performance issues, decision making, management mistakes, or stress. Organizational ergonomics. This type of ergonomics focuses primarily on the structural issues of professional system, organization of the processes and operational regulations. It privileges contacts are human resources managers. They work in particular on issues related to timetables, working rhythms, modalities of activity. What are the causes of workplace injuries? The main causes are overexertion is the leading cause of injuries. Reoccurring persistent pain may develop in the future. Bodily reaction is another leading cause of the injuries in workplace. Repetitive motions also within uh, top 10 most common workplace injuries. Musculocutaneous disorders or MCDs affect the muscles, nerves, blood vessels, ligaments, and tendons. Symptoms include discomfort, pain, numbness, loss of motion, flexibility, spasticity, or stiff joints. Common musculoskeletal disorders (MCDs) are carpal tunnel syndrome, tennis elbow, bursitis, ischemia, sciatica, herniated disc, neck strain or disability, and tendinitis. Most affected areas are back, arm, elbow, shoulder, neck, hands, wrist, and fingers, knee, ankles, and feet. Risk factors of MCDs include these depend upon work position and postures, how often task is performed, and level of required effort and duration of task. Prevention of MCDs on methods of protecting against MSDs includes establish ergonomics program that include training, feedback at all levels, conduct job hazards analysis, and early recognition and reporting of potential MSDs. Examples of engineering controls that includes workstation design and setups, ergonomics design tools, ergonomically designed equipment, load or weight reduction. And examples of proper work practices include proper lifting techniques, team lift, heavy, bulky, awkward loads, work rotation, task variety, and increase rest breaks. Example of personal protective equipments, Gripping gloves, knee pads, vibration gloves, thermal gloves, lifting straps, and lifting braces, etc. And the physical hazards when reaching above the head and the shoulder. Working with the hands above the head for more than 2 hours per day, or working with the elbow above shoulders for more than 2 hours per day, then these cause physical hazards. Solution of this problem is keep items within close reach, elevate work areas, remove obstacles, utilize equipment to raise and lower items or move items closer to worker. Physical hazards include awkward body postures, working with the neck or back bent forward for more than 30 degrees for more than 2 hours per day, squatting for more than 2 hours per day, or kneeling for more than 2 hours per day. Solution to this problem include raising or tilt the item for better access, use a stool for ground level work, use tools with longer handles, alternate between bending, kneeling, sitting, and squatting. And other physical hazard includes awkward grips, gripping 10 or more pounds, or applying force for 2 or more hours per day. The solution is design work layout to reduce the hand carrying, reduce amount of items carried at one time, use non-pinch grip posture, use ergonomically designed tools or aids, and use job task rotation. Repetition. When repeating the same motion for more than 2 hours per day with hands, wrists, elbows, shoulders, or neck. Solution to prevent from this problem includes arrange work to avoid unnecessary motion, let power tools and machinery to do the work, spread repetitive workout during the day, and take stretch pauses, rotate tasks with co-workers if possible, and change hands or motion frequently. Awkward lifting. Heavy, frequent, or awkward lifting cause physical hazards. Solution to this problem include proper planning, minimizing lifting distance, position material to power zone levels, avoid manually lifting or lowering load to or from floor, identify or reduce unstable or heavy loads, reduce frequency of lifting and duration of lifting task, providing clear access. Occupational health services. The basic occupational health services are an application of primary healthcare principle in the sector of occupational health. Primary healthcare definition can be found in the World Health Organization Alma Ata Declaration from year 1978 as the essential health care based on practical, scientifically sound, and socially accepted method. It is the first level of conduct of individual, the family, and the community with the national health system bringing health care as close as possible to where people live and work. An effort was launched by the International Commission on Occupational Health to develop basic occupational health services. And occupational health services are available to only 10 to 15% of workers worldwide. Surveillance of work environment and risk assessment. The surveillance of the work environment is one of the key activity of basic occupational health services. Ergonomic factor which might affect workers' health, conditions of occupational hygiene, and factors such as physical, chemical, biological exposures which may generate risk to the health of workers, exposure of workers to adverse psychological factors and aspect of work organization, risk of occupational accidents and the major hazards, collective and personal protective equipment and control systems designed to eliminate or prevent or reduce exposure. Health examination, pre-assignment, pre-employment health examination, also includes periodic health examination, return to work health examination, general health examination at termination or after ending of services. First aid and participation in emergency preparedness. Providing first aid services at the workplace when appropriate. and introducing and training first aid practices to workers and supervisors, maintaining and periodically inspecting the first aid readiness and facilities, participating from the health point of view in emergency planning and organizing the health element in emergency response. Diagnosis of occupational diseases. This includes identification of exposure which may cause disease, examination of clinical findings which are known to be associated with specific exposure, exclusion of non-occupational factors as a possible cause of disease, statement on occupational disease for workers' compensation, proposals for preventive actions to the workplace of the workers in concern, and notification of occupational disease to authorities. Record keeping. General health record if the workers are treated as patients or health service client, data on surveyed, detected and measured occupational exposures and risk assessment which have been made, statistics on occupational disease and injuries, data on health examination and documents on proposals for preventive and control measures. And laws at national level includes the Mine Act 1923, the Factories Act 1934, the Boiler Act 1923, the Explosive Act 1884, the Petroleum Act 1934, the Dock Labour Act 1934, the Workmen Compensation Act 1923, the Boiler and Pressure Vessels Ordinance 2002, Punjab Labour Policy 2015, and Pakistan Occupational and Safety Act 2018. Pakistan Occupational Health and Safety Act 2018, an act to ensure safe and healthy working conditions for people at work by authorizing enforcement of the rules and regulations developed under act by assisting and encouraging the organizations, institutions and geographic areas governed by federal government in their efforts to ensure healthy and safe working conditions by providing for research, information, education, and training in the field of occupational health and safety. Global Plan of Action on Workers' Health 2008 to 2017. This plan links occupational health to public health by identifying the following objectives for global action. To devise and implement, these points includes to devise and implement policy instruments on workers' health, to protect workers' health, to improve the performance of and access to the occupational health services, and to provide and communicate evidence for action and practice, and to incorporate workers' health into other policies. Now coming to the recent updates. Our first article is the role of home workstation ergonomics and gender on the musculoskeletal pain. The recent mandate for university faculty and staff to work from home during COVID-19 pandemic has forced employees to work with suboptimal ergonomic workstation that may change their musculoskeletal discomfort and pain. As women report more work-related musculoskeletal discomfort, this effect may be exacerbated in the woman. The results of this study include 61% of the respondents reported an increase in musculoskeletal pain, with the neck, shoulder, lower back being reported most frequently. Women reported significantly greater musculoskeletal pain, but this relationship was significantly mediated by poor ergonomic design of the home workstation. Improper seat height, monitor distance were statistically associated with total body work related musculoskeletal discomfort. Conclusion of this article is work from home has worsened the employee musculoskeletal health and ergonomic gap between women and men in the workplace has persisted as work from home environment with seat height, monitor distance being identified as a significant predictor for discomfort or pain. Second article is Teachers' awareness and practices on school ergonomics in Karachi, Pakistan. As the students spend most of the quality hours for the entire day in the school environment, therefore their safety and security are the priority of school administration and teachers to keep them secure from the injuries and other health issues. Students mostly rely on teachers for their daily academic activities within the classroom environment. A qualitative case study was conducted in a private school of Pakistan to investigate teachers' perception about school ergonomics and their practice, which directly or indirectly influence school ergonomics. The result indicate that ergonomics is highly valued in school education for student safety and health. Teacher introduce appropriate physical exercise in the classroom to keep children healthy and active during school hours and provide postural awareness for developing proper body posture. Counseling parents on ergonomic risk factors was suggested along with ergonomically designed furniture in the classroom and the use of light material. Backpacks are also recommended. Now coming to MCQ session. First MCQ is, in a textile factory, workers are frequently experiencing repetitive strain injuries in their wrists and hands due to the nature of their work. What action should be the management prioritize to address this issue? Option A is implementing regular breaks for stretching exercise. Option B is ignoring the problem. It is common in the textile factories. Option C is providing workers with over-the-counter pain relievers. Option D is introducing automation to reduce the manual task. Option E is increasing the speed of production to meet the target.
D.
Answer is A, implementing regular breaks for stretching exercise. MCQ number 2 is Global Plan of Action, whose mandate is to advance social and economic justice through setting international labor standards. The main objective of Global Plan of Action about occupational health is option A, promotion of well-being, option B, protection of workers, option C is placing the workers at the appropriate place, option D is providing treatment to the workers, option E is decreasing workload on workers. Answer is option B, protection of workers. MCQ number 3 is, worldwide there are many types of accidents related to occupational health hazards. Most common type of injuries related to occupational hazards include option A, musculoskeletal injuries, option B, burns, option C, fractures, option D, cancer, and option E, blindness. Answer is
B.
option A, musculoskeletal injuries are the most common. In XYZ factories, there is proper design and setup and ergonomically designed tool. Which type of control method is used in this factory? Option A, engineering control. Option B, personal protective equipment. Option C, administrative control. Option D, proper training. Option E, proper health assessment. Answer is option A, engineering control. MCQ number 5 is, a newly established office is designing at its workstation. Which ergonomic principle should be prioritized to ensure the health and productivity of employees? Option A, providing adjustable chairs and desks. Option B, installing bright overhead lighting. Option C, placing computer monitor at eye level. Option D, encouraging employees to take frequent breaks. Option E, using ergonomic keyboards and mice. The answer is option C, placing computer monitor at eye level. MCQ number 6 is, a healthcare facility is considering setting up occupational health services for its employees. What would be the primary benefit of implementing such services? Option A, decreasing employee morale and job satisfaction. Option B, reducing absenteeism and increasing productivity. Option C is increasing workplace accidents and injuries. Option D, ignoring employee health concern. Option E is fostering a culture for disgrade of employee well-being. Answer is option B, reducing absenteeism and increasing productivity. A construction company is experiencing experiencing an increase in back injuries among its workers. What steps should be taken to address this issue? Option A, implementing a mandatory exercise program for all workers. Option B, providing proper lifting training to the employees. Option C, reducing the workload to decrease physical strain. Option D, ignoring the issue at it is inherent risk in the construction injury. Option E is offering workers a bonus for completing tasks quickly. Answer is option B, providing proper lifting training to employees. MCQ number 8 is in an office setting, employees frequently complain about neck and shoulder pain due to prolonged computer use. What strategy should be adopted to prevent such musculoskeletal discomfort? Option A is providing ergonomic chairs and desks. Option B is ignoring the issue as it is common in the office environment. Option C is encouraging employees to work longer hours. Option D, reducing working hours. Option E is training of workers for right sitting posture. Answer is option A, providing ergonomic chairs and desks. A warehouse is experiencing an increase in musculoskeletal injuries among its workers who frequently lift heavy boxes. What intervention should be prioritized to prevent these injuries? Option A, providing training on proper lifting techniques. Option B, ignoring the issue as it is inherent in the warehouse work. Option C, increasing the weight of the box to build muscle strength. Option D, reducing the number of breaks to meet the production target. Option E is implementing a punitive system for workers who report injuries. Answer is option A, providing training on proper lifting techniques. MCQ number 10 is a healthcare facility. Nurses often suffer from back injuries due to lifting patients. What method should be implemented to reduce the risk of such injuries? Option A, providing mechanical lifting aids. Option B is encouraging them to the physiotherapy sessions. Option C is increasing the number of patient to assigned to each nurse. Option D is reducing the frequency of safety training sessions. Option E is introducing the longer shift to cover staffing shortage. Answer is option A, providing mechanical lifting aid. This is the key of MCQs, and these are the references of my presentation, and this is YouTube link of our presentation where all presentations are uploaded. Kindly like and subscribe, and thank you.
Thank you very much, Dr. Marina. Very nice presentation.
Thank you, Dr. Naila.